Have you ever looked at a model of a human skeleton and wondered, why exactly isn't your skull just one solid bone? I mean, it seems like a single, hard helmet would be the absolute best way to protect our most vital organ, right? Well, the truth is actually far more dynamic than that. Welcome to today's Explainer. Today, we are diving deep into skull anatomy, specifically exploring this incredible network of joints and intersections that literally hold our heads together. Here's a quick roadmap for our tour today. We're going to start by looking at the true purpose of cranial sutures, and then step back in time to look at fontanelles in the infant skull. From there, we'll map out the neural cranium, or brain case, and the visceral cranium, which is your facial skeleton. And finally, we'll pinpoint some crucial cranial landmarks that are absolute lifesavers in the medical field. All right, let's just jump right in. Part 1. The purpose of skull sutures. You know, if you've ever seen those intricate, zigzagging lines running across the surface of a skull, you've probably wondered what they actually do. To break down the medical jargon, those zigzag lines are called cranial sutures, and they're classified as synarthroses. Now, under normal circumstances, these are highly rigid, immobile joints. Unlike your knee or your elbow, there's absolutely no joint chasm here. Instead, adjacent bones are locked tightly together by this super narrow gap filled with fibrous connective tissue, mainly highly durable type 1 collagen. You can almost think of them as the tectonic plates of your skull. That zigzag, almost fracture-like appearance, it actually increases the surface area of contact between the bones, which gives the entire structure immense strength to protect the brain underneath. Moving on to part 2, let's talk about fontanelles and the infant skull. Because you see, our skulls don't actually start out locked into place. Let's look at how this builds from the very beginning of life, where our skulls starts out looking a lot more like a set of separate puzzle pieces. In newborns, the cranial bones are incompletely fused. You'll see these wide, soft, membranous areas where ossification just hasn't happened yet. We call these fontanelles, or more commonly, soft spots. And they serve two incredibly practical functions. First, they act as flexible expansion joints, which allows the cranial bones to slightly overlap so the baby's head can safely pass through the birth canal. And second, which is just as important, they allow the brain and the skull to grow and expand really rapidly during those crucial first few months of life. Now, every newborn has 6 of these fontanelles, and they definitely do not all close at the same time. Looking at the timeline here, you've got 2 major ones on the top. The massive frontal fontanelle usually stays open the longest, closing around 18 to 24 months. Then there's the smaller occipital fontanelle at the back, which closes much faster, usually by the 2nd or 3rd month. Then you have 4 smaller, paired minor fontanelles on the sides of the skull. Those are the sphenoid and mastoid fontanelles, and those close anywhere between 6 to 18 months. As the skull expands and that connective tissue diminishes, these soft spots transition into the tight sutures of an adult. Okay, here's where it gets really interesting. Part 3, the neurocranium, also known as the brain case. Let's watch how these flexible infant joints completely ossify into this impenetrable vault. The crucial thing here is how these joints map out spatially. If we trace the major sutures holding this protective dome together, you'll see the coronal suture running horizontally right across the top, almost like a crown, joining the frontal and parietal bones. Then, on the lateral side, there's the squamous suture, securely fastening the temporal bone to the parietal bone. And running straight down the midline, right down the center top, is the sagittal suture. By the time a person reaches their 20s, these major lines have mostly fused into solid, rigid bone. But check this out. This is a highly fascinating and honestly often misunderstood anatomical variant. Right in the middle of the forehead is the metopic suture. When we're born, our frontal bone is actually in 2 distinct halves, separated by this exact line. Normally, it completely fuses and essentially vanishes by the time a baby is about 9 months old. However, in some adults, this metopic suture persists, and clinically, this is a huge deal. If an adult with a persistent metopic suture comes into the ER after a head injury, an untrained eye looking at an X-ray could easily misdiagnose this perfectly normal biological line as a severe skull fracture. Wild, right? All right, moving to part 4, the viscerocranium, or the facial skeleton. Let's shift our focus away from the brain vault and look at the front of the skull, exploring this incredibly intricate and delicate bone network. While the brain case uses these long, sweeping lines, the facial skeleton is built from a complex web of much smaller connections. Take the internasal suture, for instance. It acts as a bridge going straight down the middle of the nasal bones. What's super interesting about facial sutures like this is their timeline. The internasal suture actually doesn't even begin to close until a person hits their 20s, and it might not totally finish fusing until they are well into their 30s. So how does the face actually attach to this protective brain helmet? Well, it does so through specific intersecting bridges between the neurocranium and the viscerocranium. If you look closely at these junctions, you can spot the frontonasal suture bridging the nose to the forehead and the frontozygomatic suture linking the cheek area to the outer rim of the eye socket. These interlocking mechanisms perfectly ensure that the delicate facial bones and the heavy brain case operate as one structurally sound, unified machine. Now, this next part is absolutely crucial, especially if you're neurosurgery. Part 5. Crucial cranial landmarks. We're going to look at the precise waypoints where multiple sutures and bones collide. First up, we have to talk about a landmark known as the pterion. This is an H-shaped intersection situated right on the side of the head. It's essentially a four-way stop where the sphenoid, temporal, frontal, and parietal bones all converge. Because you've got so many fibrous joints meeting in one single location, it creates a very unique architectural situation. The pterion, located right here on the temple, is an absolutely critical mapping coordinate for surgeons approaching the middle cranial fossa. But more importantly for us, it is a major anatomical weak spot. It's highly prone to fractures, and to make matters worse, running directly underneath the bone at this exact spot is the middle meningeal artery. A strike to the pterion can easily rupture that artery, leading to a massive, life-threatening bleed known as an epidural hematoma. So as you can see, while sutures generally provide strength, their intersections can sometimes create profound vulnerabilities. But landmarks aren't just on the sides and top of the head. They form an essential map on the underside of the skull as well. When you view the base of the skull, you find coordinates like the Bayesian, perfectly centered on the anterior rim of the foramen magnum, which is that giant hole for your spinal cord. Further back, you have the inion, the most prominent bump on the back of your head. For radiologists reading complex scans or anthropologists measuring ancient remains, these precise points serve as incredibly reliable universal waypoints to navigate human anatomy. So, what does this all mean? Well, it brings us to a final, fascinating thought. What will your cranial sutures tell archaeologists centuries from now? Because these sutures ossify and fuse at highly specific, documented ages, some in infancy and some not until our 60s, our skulls carry a permanent, readable history of our biological age. Centuries from now, a forensic scientist or archaeologist could quite literally read the zigzagging lines on your skull to learn exactly when your life's journey ended. Pretty amazing to think about. If you found this breakdown of our body's hidden architecture helpful, make sure to subscribe for more simple medical explanations. Thanks for joining me on today's explainer, and I'll catch you in the next one.